Basically, again, these are sometimes referred to as vouchers or mobile vouchers. I myself think of them as a piece of paper. It's a housing subsidy that allows a household or an individual consumer to choose the housing they want to live in, as long as it's affordable, safe, and the rent is reasonable. So somebody can move with a tenant-based voucher and still have a subsidy. It kind of goes with you, so if you're assigned an MRVP voucher and you obtain housing and, 2 years later you decide to move, you take that voucher with you and you find another place. And the tenant-based vouchers, they have a rent that's set by the issuing housing authority. Okay, next slide. So rent calculations. So for tenant-based vouchers, the rent is calculated using either 30 to 40% of a tenant's gross income. So both state and federal public housing have certain exclusions and deductions that are used to determine the adjusted income, but the deductions are not the same for all programs. For example, some programs might take into consideration what a person pays in utilities, specific utilities, or a flat rate. Sometimes they take into consideration healthcare, out-of-pocket healthcare costs, not all programs. So most voucher programs do have deductions if the head of household is elderly or a person with a disability. So this is the first one. So the Housing Choice Voucher Program, the HCVP. So this is a federal Section 8 program. This provides a subsidized voucher to a household or a consumer to find housing of their choice in the community of their choice. So this can be used anywhere in the country that is covered by a public housing authority. And just a few bullets about the voucher. So the household must be under 50% of the AMI, the area median income. These are limits that are set by HUD. They're administered by the public housing authorities and or by the regional administrating agencies. The tenant will pay 30% of the adjusted income as rent, and then the voucher will pick up the remainder. To apply, there is a paper application to apply. Okay, and sorry, section, just trying to read my own writing here. So I did provide a link here where you can apply, but there's also the paper application. I think I have an error on this slide because I have it as the MRVP. So I apologize for that. I'll have to check to see if that link actually is the MRVP. But there is a paper application and there is a link. If that's not the correct link, I will provide one. Okay, so we're going to move to the next slide. So then we have the MRVP. This pretty much is the same, but this is a state funded. So that's really the only difference between these two vouchers. One is federal dollars, one is state dollars. It really doesn't apply to your consumer, it's a voucher that is used and works in the similar fashion. The difference though, because it's state dollars, this has to stay within Massachusetts. So the federal one can be within the country. The MRVP has to stay within Massachusetts, but any city or town in which will accept it. And the criteria is pretty much the same. The person has to be under 50% of the area median income. When it says households, hopefully most of you know, so you can have a consumer being a single, applicant, single household, or when it says household, if the consumer has a spouse, has children, or just wants to live with their sister, then that's what they mean by the household. Every person that's going to live in that unit has to, be considered. So these are administered also by the public housing authorities. The voucher value is a set amount. The amount is determined by several factors, based on the tenant's income, the household size, and the geography. So these are going to vary based on city and town. And again, that's determined by HUD. The participant pays the difference between the value of the voucher and what the landlord charges for rent. So here it is. So you can do the paper application or you can apply by the link. And then the hard copy of the application is on that link there. So I did find in putting together these slides some time ago that the paper applications are not really easy to find. It's clear to me that the housing authorities, the regional administering agencies, most housing programs, they do prefer electronic submission, even though that's not, we know, in the field that you're in, a lot of your consumers don't have that luxury. You know, they would still prefer a paper application. So most of these programs you can still apply by paper, but it's not always easy to find that paper application. So I did do some digging and I did provide the links on the ones that I did find. You know, if there are any that you just can't find a paper application for, you know, you can let Rachel know or let me know, and I can do my best to try to track one down. But again, I think most of these programs are trying their hardest to move over to electronic version. Okay, so the next slide. So then we have the AHVP. So this one provides rental assistance to non-elderly persons with a disability who have low income and have been determined eligible and qualify for the elderly or handicapped housing. So these, like the previous one, they're state funded and they must be used to find housing anywhere within the state of Massachusetts. So again, the households must be under 50% of the AMI, area median income, and be eligible under the age of 60 with a disability. These are also administered by the public housing authorities. The tenant's going to pay 25 to 30% of net income as rent, and the voucher is going to pick up the rest. So this particular one, you have to apply through the CHAMP, which again, we're going to go over later in the presentation, but that's the electronic version right there of the CHAMP application. And then we have the Lynn Housing and Neighborhood Development, better known as the LHAND, Special Purpose Voucher, Housing Voucher. So like the others, this is a mobile piece of paper that the person uses to find, you know, housing of their choice, community of their choice, somebody that will accept it. This is a special type of Section 8 voucher. It's used for a very specific population. The vouchers are issued by LHAND. LHAND is Lynn Housing Authority, and they can be used anywhere in the state of Massachusetts. A lot of people confuse this. They think that, oh, my consumer doesn't want to live in Lynn, I'm not going to apply for that. They do not have to. They can live anywhere in the state of Massachusetts. It is a mobile voucher. That's a very common misconception about this voucher. The eligibility is not real strict, but it is defined. You know, the person does have to be between the ages of 18 and 61. I don't see a lot of ASAPs using this, and most likely that's because of that age cutoff, although they might have some consumers that might fit that bill. As long as the consumer is under 61 at the time that the voucher is administered, then they would still be eligible. The person does have to have a disability. This one, they have to be at the time that they're applying, and then at the time, if a voucher is offered, they have to be in an institution. And this one, it's different than the rest in that most applications that you might assist your consumers with or refer your consumers to, your consumer is going to be the point of contact. So let's say your consumer does the CHAMP application to apply for the MRVP, the AHVP. Your consumer is going to be the person contacted, you know, by DHCD, by the housing authority, if and when an opportunity presents, or if it's time to update some information. With the LHAND, there's a referral form that comes along with it. And you, being the options counselor, case manager, again, whatever your respective title, you are the point of contact. So you do the referral form, you state which institution your consumer's in, you fill out, you know, you have them help them fill out the application, have them sign it, you submit it through me. And then if and when your consumer's name comes to the top of the list for this program, you're going to get emailed as the representative, not your consumer. And you're going to get an email that simply states, is so-and-so, so is Joe Smith still in Tewksbury State Hospital? And if the answer is yes, then that basically means that that person's name has come to the top of the list. And now Lynn Housing is going to be in contact with you for some additional paperwork. The initial application is like a preliminary application. So there will be different paperwork, you know, after the fact or at the time that a voucher is administered. But this program, I'm always telling Rachel, this is one of the most underutilized programs that I see. A lot of people think that, you know, it doesn't apply to them, or they just simply don't know about it, or they forget about it. But this really is a program as an options counselor, or again, whatever your respective title. If you're working with folks on a regular basis that need housing and you're a person that your job brings you to nursing homes, skilled nursing facilities, hospitals, you know, your consumers, that's where a lot of them might be at the time of referral, at the time of initial contact. You should automatically be considering an LHAND application with that individual, because as long as they have a disability and as long as they're, you know, under 61, they're going to qualify based on the fact that they're in an institution. So you really, I can't stress enough, this is an underutilized program. These vouchers, I don't want to say they're fast, but because they're underutilized, your consumer stands a good chance if you submit an application under this program. So I would strongly encourage you to familiarize yourself with it. The one downfall of the program is, and I'm working with Lynn Housing, for some reason they're hesitant about putting the application on their website. So Rachel did attach the materials to apply to your invite for today's training. So as long as you have those materials, there's a referral form, and then there's an application, and then there's just a signed HUD release that goes along with it. And again, you fill those out, you have your consumer fill them out, sign off, those get returned to me. I kind of keep track, and then I work with Lynn Housing behind the scenes, and they process those, and they, you know, issue those when they become available. So that's the one downfall. I am hoping at some point that you'll be able to access these more easily, either on the LHAND website or maybe on mass.gov. We're going to look into that option. But for now, you did get them in an email. Please share them with your colleagues, anybody that might need them. Save them to your desktop, or you can, you know, you can always reach out to Rachel or to myself to request another one. But again, this is a mobile voucher. Very common misconception with LHAND that it's only for the city of Lynn. It is not. It just happens to be that the Lynn Housing Authority is where it sits, and they're the ones that administer them, but person does not have to live in Lynn. Okay, next slide. So those are some of the mobile voucher options. And again, it's not an all-inclusive list, but that's kind of the most common ones for the state, the most commonly used ones. So now we're going to talk about some project-based options.
Yeah, Jennifer, I just want to check to see if you want to pause to take any of the questions in the chat yet or not.
Not yet, Rachel. I'd like to get through a few more slides.
Sure. Okay.
And I should have said that at the beginning too, just because we're on a time constraint, and I know Rachel's so good about keeping things moving and not running over. Housing is so complex. I do ask that you hold questions, just, you know, either jot them down or put them in the chat, but sometimes folks in the training will ask questions that might be coming up on a next slide. So we will be breaking at somewhere halfway between, and then again at the end to allow for some of the questions, the Q&A. Otherwise, I don't think we'd get through the material. So we're going to talk briefly about congregate, CBH, and some state-aided public housing. So what is project-based housing? So basically, these are subsidies that are attached to a specific apartment in a specific building. These are not going to move. So make sure you're clear with your consumers. If they're applying for a CBH unit in the city of Dorchester, that they really do want to move to Dorchester because that subsidy is where it is. It's not going to move. It's attached to the unit. Some types of project-based housing are public housing. They can be owned and run, again, by the local housing authority, like as you saw with the mobile vouchers. For public housing tenants, the housing authority is your landlord. Then we have some multifamily subsidized housing. These can be a private landlord, private development that has received government subsidies to provide affordable housing. So congregate housing, I'm guessing probably a lot of you are probably most familiar with this. Congregate is basically a shared living environment. It's designed to integrate housing and service needs of elders and folks with disability. I know sometimes there's a misconception with congregate as well, that it's only for, you know, folks over the age of 60 or what's considered elderly, but it's not. It is open to folks with disability as well. So typically in a congregate setting, each resident will have a private bedroom, but they do share the common areas like the kitchen, any dining facilities. Most of the time they're sharing a bathroom. I think there are some congregate settings that might have a private bathroom attached to the bedroom, but not all. Congregate housing coordinators are on site at each one of these locations. They ensure a stable environment and they foster a sense of community. They can also help residents to access resources, manage issues that arise from shared living. A lot of them they plan social activities, holiday dinners, holiday parties, things like that. A lot of them might coordinate transportation to certain like community events, things like that. That being said, the congregate housing coordinator, they do not offer a 24-hour care and supervision. I think sometimes people think that the role of that person is to kind of look out for each individual and be there for whatever they need. That's not really the case. I mean, if the person needs PCA, personal care, then that's what they need. This is like a generalized person. The person does provide a level of safety, being a set of eyes and ears in the building, but they're not there 24 hours and they're not there to supervise or like physically assist a person with physical needs that they might have. Services are available based on program eligibility to aid residents in managing activities of daily living in a supportive but not custodial environment. This number might be inaccurate, but the last time I looked it up, there were 43 sites in the state of Massachusetts. And again, they vary in size and design. They have the capacity to house 561 residents. So if you want to look at a full list of sites, you can go to that link there and it kind of lists them all. Congregate is a wonderful option. A lot of times the list to get into Congregate is not quite as long as, let's say, for a mobile voucher. If your consumer is willing to consider this option, then they might find themselves housing quicker than they would if they were to wait on a list for a mobile voucher. But it's not for everybody. The person has to be somewhat social and kind of like that idea of having shared common spaces and having other folks around. If they're a person that's very private or has some kind of disability where they just are fearful of others or something like that, this might not be the best option. I would strongly recommend too. I don't know how many of the ADRCs do this still, but I know that people used to kind of join forces, the ADRC, the ILC, and the ASAP geographically and tour different sites, because it's hard, as an options counselor, to learn all these different programs, to learn all the different resources, and to kind of have an overview of, oh, it's a community living. To actually go there and see it for yourself, provides a whole different perspective. So I would strongly encourage, if you don't do that already, if there's a congregate site, most of you are going to have some kind of congregate site or sites in your area that you serve. You should reach out to the housing coordinator and arrange for some kind of a tour, as a group of OCs, and go out and see these facilities and have a chance to ask questions. Okay, next slide. So we're going to talk about CBH, community-based housing. So I hope everybody on this training gets emails from me on CBH. If you don't, please email me individually after the training or during the training and just say, please add me to your list. So community-based housing, this is a housing development program. This is kind of behind the scenes. It provides capital funds to developers to set aside units for persons with disability who are residing in institutions or at risk of institution. So basically the criteria for CBH is these 3 bullets. The person has to have a disability. They cannot be a consumer of DDS or DMH. I often get questions and calls about this. Can an exception be made? My consumer is DMH, but they really need this. Absolutely not. There's no exceptions to this program. There's reasons behind it. Any of you that might be familiar with DMH or DDS, they have different housing funding, different programs that they are eligible for that no one else is eligible for. So it kind of evens out the playing field, if you will. But there's no exceptions to that. A DDS or a DMH consumer is not eligible for CBH under any circumstance. And the priority to CBH units goes to individuals who are currently in an institution or who are at serious risk of going into an institution. So again, part of my role is I kind of serve, I think of myself as the middleman, so to speak. So I serve to educate providers statewide. So all of you here today, ILCs, ASAPs, I work with DMH, MRC, CSPAC, DDS. I work with all the state entities, but then on the backside, I sit in meetings with developers and property managers. So I'm kind of that middle person. So whenever a property has an opening in a CBH unit, they contact me to let me know. I get those out to all of you as soon as the same day, as soon as the information comes on my desk, I get it off my desk and get it out to all of you, because you are the folks that are working with individuals directly that need these type of housing units. And the CBH is, I think of it as a little gold mine. These are available now. You're not applying for a CBH to go on a waiting list or to go into a lottery. You're applying for a unit that's vacant December 1st, or it's already vacant, and it's usually first come, first serve. There are a few exceptions. When a property is brand new, there might be a lottery initially just to even the playing field. But when it's a unit that's already in existence and there's turnover, somebody moved out, that's a first come, first serve. So when you get this email from me, it's going to tell you the location, the address. Sometimes there's specifics, most of them are general, but every once in a while there's a property that might be 60 and over, veteran preference. You don't see that a lot, but you see it once in a while. So you got to kind of read the details. But as long as your consumer meets those 3 criteria, these are units that are available. So you want to, talk to your consumers, and you want to get the application back, and you provide that application back to the property. And then they handle it from there. So, and again, these are units that the property does not want vacant. They need them filled, and they're going to do it fast. They're going to do first come, first serve. So when you see these emails from me and it's applicable to a consumer or consumers that you're working with, get that application in and get it in quick. And again, if you're not already receiving those emails from me, please email me after the training, during the training, and I'll get you on that list. Okay, next one. So then there's the state aided public housing. So again, these are managed by the local housing authorities. These are again project based. So for public housing tenants, the housing authority is your landlord. There's over 240 local housing authorities. They're responsible for the management and operation of public housing assistance throughout the state. The units come in various bedroom sizes. So you're going to have, 1 bedroom, elderly only. You're going to have family units. You're going to have some that are 2 bedroom, 3 bedroom. You don't see really too many that are 4 bedroom. There might be a couple of them out there, but they do have some family units. But again, these are based on income, and they're for low income families, elderly households, and/or persons with disabilities. The housing authorities use the same income limits developed by HUD. Back to that AMI, the income limits are going to vary from area to area. And again, with every other project-based subsidy, it stays with the building. So when a tenant is offered a tenant-based, project-based unit and they accept, that's great. Then they decide to move out. Well, they just lost their subsidy because the subsidy stays with the building. And to apply for any state-aided public housing project-based, you're going to go through the CHAMP. And again, there's the link for the CHAMP application. Okay, we'll go through the housing wait list, Rachel, and then we'll take some questions. So what happens, after I apply? My consumers applied for a couple of these different options, and now what? What do we need to know now? So again, what happens when I'm put on a waiting list? So if the application for any housing program is accepted, your name goes on a waiting list for that program. You then have to wait until your name comes to the top of the list. Staying on the list. So during the time you're on the waiting list, and again, this is going to vary because every housing program, there might be private developer, it might be a housing authority. It's all going to vary on the program that you might be congregate. It's going to vary on whatever you applied for. But from time to time, housing agencies, properties, they might send that consumer a letter in the mail, some kind of a notice asking, are you still interested in being on the waiting list? Typically, anything in the form of mail has a deadline that that person is expected to respond. It might say that you're missing this, this, or this, or we need updated information on this. And it's going to give you probably a 2 to 3 week window to get that back. So what happens is if the consumer doesn't respond to that piece of mail, they don't respond by the deadline, there's no more communication. They're basically just they're dumped off the waiting list. And that's a big problem with a lot of consumers because they think that, well, I applied, I've been on the wait list for 8 years, but they've never responded to something like this. And they think they're still on that wait list when in reality, they're not. They were taken off that list years before because they never responded to a request from the housing authority to respond by a deadline. And again, the housing authority isn't going to follow up and say, we've removed you from the waiting list. They just do it. They just remove you if you don't respond by that deadline. So that's very important. Notify your consumers about that. This is another piece. If you move, and again, we know a lot of these consumers, if they need housing, they probably don't have stable housing right now. That's why they're reaching out, working with an options counselor. They might be couch surfing. They might be homeless. Chances are from the day that they apply, they are going to move again. They are going to stay on a different couch. They are going to be in different settings. Very important that consumer, every time they have a different mailing location, to send written notification of the new address to every single place where they've submitted a housing application. And yes, that is a chore, and yes, that is burdensome, but it's part of remaining on a wait list. If you don't do that, then chances are that consumer is dropped from those waiting lists. This is where the electronic component comes in handy. And again, for all of us as professionals, I'm sure most of you, I know I would prefer to just go online, go in there, update my address, boom, it's done. I don't have to mail anything out. But for a consumer that doesn't have technology access or ability, they might have to, send that letter, put it in writing, send it in the mail. But very important that they keep their address up to date with any housing program that they apply for. Okay, so how long will I wait? This is another common question we get. There's no answer to that. I can't answer that. No one on this call can answer that. They vary from housing program to housing program. It can be, the person can get lucky. They can wait years. There's really no answer to this question. The goal is to get your consumer to apply to as many housing programs and locations as they're willing to apply to, because without doing that, they're gonna end up waiting longer. I'm sure you've all worked with that consumer that says, I'm not gonna waste my time applying for that because there's a 10-year waiting list. Why would I bother? Well, the answer to that is, well, you're never gonna get an offer of housing if you don't get on a wait list. People are afraid of wait lists. Nobody likes that word. Nobody wants to hear you're on a wait list. Wait lists do move. Some of them are slow, yes, most of them are. However, they do move, and you'd really be surprised at how outdated wait lists get real quick. And the housing authority or private management company, they don't really have any way to know that. Nobody's going through a waiting list on a regular basis. They go through that waiting list when a unit becomes available. So let's just say a property has 200 names on a waiting list, a unit becomes available. They start calling or contacting the people in order of the waiting list. Half of these people have moved. Half of these people have not updated their address, so now they're dumped. Before you know it, number 97 is being called as the first available person that they've been able to get in contact with. Properties are not going to wait. Housing authorities are not going to wait. So again, it just goes back to keep your name, keep everything you can up to date, keep your address up to date, and your contact information, like a phone number, up to date so that you can be contacted if and when your name comes up. Because trust me, half of the people on the waiting list before you haven't done that. And so even though their name might sit on a piece of paper ahead of yours, when it comes time to make those contacts, those people are going to be eliminated. So don't let waiting lists discourage your consumers. And again, there's just no answer to how long will I wait. But my only logical answer to that is get on as many waiting lists as you can, and you're going to see your wait time decrease. And again, try not to get discouraged. They do move. Your name eventually will come up. Another important piece, and this will be the next part of the segment, is make sure you're ready when you get that call, when an opportunity does present. Don't, we're going to get into core documents in that piece, but you don't want to be that consumer or have that, be working with that consumer who finally got a call after 9 months or whatever, a year. Oh, this housing authority wants to set an appointment. I think there's a unit available, and this person doesn't have anything that they need. That's going to be a problem. And then the only last piece on this is keep a log. So just like you want to update your waiting, your address and your contact information, I would encourage your consumers to keep a log, help them with that, whatever works best for them. Maybe it's an old-fashioned piece of pen and paper. Maybe if they are a little tech savvy and they have a cell phone, maybe they might just want to, send themselves a little note, however they want to maintain it, a spreadsheet, but keep track of where you've applied, when you applied, and the contact information for them. Because then again, if you go to move, you're going to be like, wait a minute, which places, which program waiting lists am I on? It gets confusing. It's not easy to navigate all this stuff. So I can't, just stress this enough. Just try to keep a log, or at least encourage them to keep a log of what programs did I apply to, what waiting lists am I on. Try to give the independence back to the consumer. I don't encourage you to do it for them. Don't maintain a log for them. That's not really your responsibility. You work with a lot of consumers. Try to get them, work with them to find a way that they can manage and juggle that to maintain their own log. Okay, next slide. Okay, so this is about, I think, halfway through the presentation. So if we want, we can probably jump into some of the questions, Rachel.
Sure. I tried to summarize some of them from the chat,
Okay.
Jennifer. But if I missed any people, please speak up. So one was on Section 8. Can Section 8 be used not only for, an apartment building, but in a private home for a room or a unit? Would they take a Section 8?
A private home, I don't think so.
Okay.
I've never heard of that.
Okay. And also, what is a recertification for Section 8? How often do you need to verify that you're still eligible? Or
well, I think with the incorporation of the online CHAMP system now, they're trying to streamline it to make it easier for themselves, but also easier for the consumer. So I think going in and updating it, will take care of that. It should take care of all the waiting lists that you're on. But if you ever the consumer does receive anything via mail, you have to respond to that. So I think that's not really a general question, because I think every program might have they might do it annually. They might do it every 2 years. They might do it every 6 months. It's going to depend on program, how often they do that. So just as long as you know something has changed, my address, my phone number, something has changed, go in and update it electronically. Call them, did you get my update? I just want to ensure that you have my new address. And or just send that written letter, copy it, make 10 copies, mail it out to all those places.
Okay. Another one was, how do you define institution when you're talking about community-based housing? What constitutes an institutional setting?
Think of it like as a hospital or skilled nursing facility setting. This question has come up before. So again, any rehab, nursing home, skilled nursing facility, in general, really, those are all one and the same, but that's basically, in a nutshell, or hospital. Someplace where that person is receiving services, like some kind of medical services, that's an institution. I've gotten the call before. Does that mean a jail? No, it doesn't. It's basically just some kind of a medical institution. And in at risk, um, you know, in a sense, we could argue that most people are at risk, but truly what it means by at risk is, let's say a person is in a wheelchair, and they don't even have a shelter as an option, because I don't know of any shelters that have wheelchair assistance. I think those that come in, or they're in the works of trying to accommodate that, but as it stands, most homeless shelters are not wheelchair accessible. So if a person is homeless, they have a disability, they have some kind of serious condition that living on the streets, it impairs their health condition, their physical status, and they don't even have the option to go to a homeless shelter each night because it's not wheelchair accessible. They can't even get in. That person truly is at risk. What's going to happen if they don't eventually secure some kind of stable housing? They're going to get hurt. They're going to get hospitalized. And then they're not going to be able to leave that hospital or skilled nursing facility because there's no safe place to discharge them to. So that's a person that's at risk. Or somebody that lives on a second or third floor unit that can no longer do those stairs due to some kind of physical disability. They're just not able to. They're going to fall, or they have fallen. So yes, they have a lease, they have an apartment, but they can't really get to it, or they can't get out of it. That's a person that's at risk, because what's going to happen? They're going to fall, and again, they're going to end up in a hospital or a medical facility. And then it's going to get time for discharge, and there's no medical professional that's going to feel safe to discharge them back to a third floor unit. So those are the kind of situations. They do vary and they get a little tricky. Another thing I should have mentioned was CBH. So on the CBH certification form, that's part of the application process that I send out in the email. It's important to explain on that CBH form, in the explanation section, what makes your person at risk if you're the one filling out that form. If they're in an institution, then you just write in Tewksbury State Hospital. If they're at risk, just the 1 or 2 sentences of what makes that person at risk.
Okay, we actually had a question that I think you just answered, because someone had asked, how do they kind of verify that somebody is in an institution? Do they need to get something from the facility verifying that?
No, because the CBH certification form is a form that has to be filled out by some kind of a professional. That cannot be filled out by the applicant or the consumer. So when let's just say you receive a CBH notification from me, it's going to have an attached housing application, it's going to have a CBH certification form, and it's going to give you the contact information for the property manager who you're going to return both of those forms to. Your consumer is responsible for the application. Get them to fill that out, get them to sign that, or assist them with doing that, get them to sign that. The certification form doesn't even go into the hands of your consumer. That's for you to fill out. So all of you are qualified as a signer for that form because you're an OC, you're a case manager. An I&R specialist, I don't know if you work directly with consumers, but I suppose you could. If you did, you probably could fill out that form. A doctor, a social worker, any kind of healthcare professional, that's who has to fill that form out, because that person is signing off that, yes, Mr. Jones has a disability. Mr. Jones is not DMH or DDS client. And yes, they are at risk for institution, and this is why. And if I have any further questions, or the property has any further questions, we're going to contact that person. We're not going to contact the applicant, the consumer. We're going to contact that healthcare professional, social service professional, and say, I need a little more information. What makes him or her at risk? But to provide it in that explanation form on the certification form is always best. Otherwise, you're just going to get a call from me at some point, or from the property asking for that information.
Okay, we had another question about the congregate housing. So is there a lower age limit for a person with a disability that as far as qualifying for congregate?
I believe as long as the person's 18, that they do qualify. Again, I think there's a common misconception that congregate is only like it's a senior housing option. And I think probably majority, if any one of us was to go visit a site, that might be the majority population. However, it is open to folks with disability. So just like most other programs, as long as the person's 18, they're considered an adult. So you could have a 19-year-old, a 22-year-old disabled consumer that would be an excellent candidate and eligible for congregate living.
Okay. If a person is homeless, how do they ensure that they're going to be able to get communications about if they're, notification about their status on the wait list or update information and so on? They don't have an address.
That gets tricky, and that's actually something that I didn't explore, and maybe one of you that is a little more familiar might know the answer to this, but I know that I'm a little old school on the universal standard. When that was still in play before the CHAMP application came live online, there was they called that same application process the universal standard application. And I know, and right in the beginning section of that one, they had a consumer name, address, but then they also said contact person or mailing address. So that would answer your question for that. Like if you wanted your mail, like, so I live at this place, but I want my mail going to this place because that's my solid, maybe my family member, my relative who's willing to take my mail because they know that I'm moving around too much and I'll miss that mail. I'll never get it. I don't know if the CHAMP has that option. I don't know if one of you might know the answer to that, but it would kind of be nice if they did. Most housing applications, again, they're going to all vary, but if it does, I would say if you're helping a consumer with applications and you don't see that option, like for an alternative mailing address or an alternative contact, put it down, like jot it down on the notes, like please mail to, and provide that address. And then if they ask, just explain that this is I don't have a stable mailing address right now. And I know it's critical that I have something that, you can contact me and this is my sister's home and she's willing to contact me if you mail me there. That's really all you can do because again, every application is going to be different, but I would just suggest if you don't see it on an application, just pencil it in,
Yeah. And somebody else is suggesting they may have to get a PO box to,
And some places won't mail to a PO box though, so that gets tricky. Yeah. And I think the universal standard used to be one of them, so it's that does get a little tricky. But again, communicate that to whatever program that is. If it's a private developer, if it's a housing authority, whichever it is, ask those questions at that time if you don't see that option, because you're right, that's very important. Sometimes an options, and I don't recommend this, but I know sometimes people will do this. I've seen options counselors or direct care staff provide theirs. And I guess maybe that might be a feasible option for some folks, but I wouldn't recommend it because you don't necessarily want to be responsible for that person's mail. What if you've moved on and then, the agency doesn't know who to direct that to. But I have seen people do that. So again, I think that's going to vary by agency, and I'm not recommending that. I'm just saying I've seen that before, that a professional, social service professional will provide their name, their contact, and say, mail me, contact me, and I'll get in touch with the individual.
Okay. Also, what proof of disability needs to be provided?
To which?
It doesn't say which program. Maybe go ahead. What?
So if that's referred to like the CBH program, there's not a proof of disability. That's I think the healthcare professional filling out that form or the social services professional. You're able to sign off on that. And again, like probably a lot of at an ILC, we don't ask for, nobody asks you for proof of disability. It's kind of the rule of thumb that if a person identifies as a person with a disability, most people are going to have Social Security as their income, the majority of consumers. That's kind of proof in itself. I mean, we know they've gone through the Social Security process and they've been deemed disabled, but it's not really, that kind of falls into a liability and a discrimination. Most places aren't going to ask You know, what's the disability? What, you know, provide proof of this or provide proof of that. As long as, again, that form is filled out by a person that is working with them in a certain professional capacity that they know they have privy to, that yes, this individual does have a disability. They don't have to list, this is the disability. This is how, you know, but in explaining how they're at risk, they might get into that a little bit. They don't, again, they still don't have to state the disability, but they do have to make a relationship about how the disability impacts the need that makes them at risk.
Okay. And just a couple more, back to the CHAMP and the Section 8, how often does the income information need to be updated, or is it just when something becomes available, you can update it at that point?
Yeah, I don't think on any housing program you have to keep updating your your income information. You know, once you're on a waiting list, you're on a waiting list. The most important thing is your contact, your address, and your phone number, because no one's going to keep going back to verify every wait list applicant. Once you're offered housing, you're going to probably have to refresh whatever you originally submitted. So some housing applications, you have to provide proof of income right up front. Some you don't. But for those that you did, you might have had to scramble helping your consumer get that Social Security benefit, get those bank statements, get their pay stubs, whatever it is. And now 9 months later, you have to do it again because the ones that you submitted at the time, they're now outdated. But that's okay. You know, that it's always got to be current. But as far as sitting on a wait list, you don't have to update income. You'll get, because your income might change at the time that you know, even Social Security disability income, it changes slightly sometimes, you know what I mean? So you're just going to provide them with the new, most current if and when you're invited to an interview and, you know, a housing opportunity kind of presents.
Yeah. Okay. The last one I see is that someone just expressing how difficult it is when somebody is in need of housing. They're being evicted at the end of the month. They don't have anywhere to go. Just expressing how difficult that is, I think.
Yeah, and it is, and that's it, and it's hard because I think in the role of this, the viewer, training viewers of this, you know, audience here, options counselors do take the brunt of a lot of that, and it's hard at the end of the day to kind of separate yourself. And I would just encourage you, remind yourself at the end of the day or the end of the week or a bad situation, it's not your responsibility to get anybody housing. Your role as an options counselor is to educate and empower the individual with what you know. So you're sharing information, you're sharing resources. I started off this presentation as saying, housing is complex. It is. It's not simple. ABC, this is what you do, you're done, it's all set. It's not. There's a million different programs out there. There's different processes for everybody, for every program, and they all have different criteria. It's a lot to take in. You're not going to, as an options counselor, know them all. I don't even know them all. I'm constantly learning. New ones are always popping up. So just know that at the end of the day, all you can do is empower your consumer with every available resource. And then when the resources you're known and tried and true don't apply or aren't working, or okay, great, they're on that wait list, but that's not going to cut it. Now what? Google and talk to your peers. You know, always share information. Any little tidbit of information that you learn, always share that with the folks around you. You know, the other options counselors, the other teams. And I, you know, that's how we grow and learn. But just at the end of the day, it is difficult. It is difficult, and we run into those situations. I get those kind of calls too. You know, I'm going to be evicted on December 1st. I have nowhere to go. I have 2 kids. I have a husband in a wheelchair. I don't have a magic wand, and neither do any of you. You know, all we can do is provide them the information we know, get them the resources we know, and advocate as strongly as we can. But unfortunately, housing is a process. Even if it's a housing opportunity like a CBH that's available now, they're still not going to apply today and move in tomorrow. They're going to need a background check. They're going to need an interview. They might have to find a way to go get a new ID. You know, they might not be moving in for 5 weeks. Like, Nothing is immediate or overnight. So just try to take that, empathize with the person, obviously show compassion, but at the end of the day, take it off your desk that was your responsibility. You failed that person because you didn't. As long as you're providing them and empowering them, the whole idea is to empower that person to be independent, to maintain independence. And how do you do that? You share with them what you know. You share with them the programs that they are that they are eligible for, and opportunities that they can take advantage of. But you're not going to be able to solve all those problems.
Okay. I'm going to just pause to give a participation code to people. And the code is the letter A. A is an apple, is the first participation code today. So I don't know if there are anything that I missed or anything else that people want to just ask Jennifer at this point, or if we can move on. And I'll just say A as an apple is the code. Okay. I'm not seeing anything else, Jennifer.
Okay. Yeah, so we'll just continue on, and then we can leave another 10 to 15 minutes at the end in case anyone does have any other final questions or, with conversation. We'll just keep plugging along. So we'll talk next about the lovely core documents, what you need and how you're going to get it. So why is documentation collection so important? This is information that's required to complete screening for housing. If the information isn't provided timely, the individual risks losing a housing opportunity. The most important documents to have on hand to collect initially is a birth certificate, the photo ID, social security card, income statements, bank statements, or any other assets that the consumer might have. Now, income and bank, I wouldn't say you need to have them on hand because, again, those are going to refresh from time to time depending on the program. But you need to at least, work with your consumer in maybe setting up a mysocialsecurity.gov account so that they'll have access to get an updated Social Security benefit letter anytime they need one. Or a bank account, make sure that they're receiving by mail from their checking account from their bank so that they can hold on to those statements for when they're needed. But the birth certificate, photo, and Social Security, if some of you haven't encountered this yet, I think sometimes people take, into consideration like those are just things people have on hand. Well, guess what? There's a lot of consumers that don't. And if you don't have any of those pieces, or let's say you don't have any of them, it's a process to get them. You have to mail out. If I was born in Texas, I'm not going to fly out to Texas to go get my birth certificate. I'm going to have to go on the, whatever city or town in Texas I was born, go on their website, download the form, fill it out, send them a check, wait for it to come in the mail. With all these delays, I don't know when I'm going to have that in my hands. It might be 2 weeks if I'm lucky, it might be 3 weeks, it might be 4 weeks. Meantime, if there's a unit that I was offered, that property or housing authority isn't under obligation to wait for me for 4 weeks and hold that unit vacant and have no rent when they have a waiting list of hundreds of other people that need it. I should have had that information on hand and I didn't. So my stress on this training is to, as soon as you hear the word, I need housing, hear those words, you want to talk about programs, but you want to stress your time on this. Let's talk about documentation. What do you have on hand from this small list? What do we need to work on? These are the conversations you want to have right from the beginning with your consumers. So next slide. And again, sometimes documentation is difficult to get for a number of reasons. Start right away. I once worked with a woman back in my beginning days. The poor woman, she had dementia. She was in a nursing home. She didn't even remember her name, never mind where she lived or where she was born. And we were trying to get the documents that she would need. And I remember sitting in a room with the nursing home, the nursing director, the social worker, And the poor consumer burst out in tears because we thought, well, we'll start with the birth certificate. So where were you born? She didn't know where she was born. How do you get a birth certificate for somebody when you don't know where they were born? You know, when they don't know where they were born. So there's some things that really get in the way. It can be very difficult. Sometimes you might get lucky and have somebody that has all this stuff, but I always say enlist their family members and their friends whenever possible, because some of these are going to be trips to the registry or Department of Motor Vehicles, whatever you want to call it, to get an ID. Sometimes you might have to physically go to a Social Security office. You don't want to, as an options counselor, have to arrange for transportation from a nursing home to, get a person to these places. Some folks do that. It's a lot of work. If that person has a sister, a brother, a spouse, somebody that can take them there, try to push back on that. Because again, getting these kinds of pieces of documentation, even though some of us might take it for granted that it's safely, in your filing station at home, these consumers, a lot of them don't have these kind of documents. So these are just going through the slides. These are just some of the ways that you can get these things. So for a consumer that doesn't have a birth certificate, there is a website. It's a fee, and I don't know what the fee is. It might even vary by city or town or state, but you can go to vitalcheck.com. I'm told most states it does cover, and you could, get a copy of your birth certificate mailed to you. You could also, if you're lucky enough that you live where you were born or you live close to there, you can physically go to the city or town hall where you were born and, get a copy of your birth certificate and walk out with it that same day. Or you could go on the website or contact the city or town where you were born and request it that way. Most websites will have a link of a form, and, you have to mail them in writing your request for the birth certificate. I've seen these range from 10 to 25 is the highest I've seen. I don't know if some places might charge more. It's just I don't even know how they come up with that price. It's a piece of paper, but that's what you can expect when you have a consumer that needs to get a birth certificate. Next slide. So then your Social Security card. Again, you can, the offices are around geographically if the consumer's mobile enough and independent enough or has somebody that can take them. Sometimes going into an office is the easiest, quickest way around. People, I know Social Security strongly encourages the my socialsecurity.gov. Like everybody should probably have an account. But again, for a consumer that maybe doesn't have technology ability or access, that's probably not going to be helpful to them. So that is an option for somebody that is tech savvy or does have somebody that can help them with that. There's also a mail-in form to have a representative, go and request the card for you. So there are different ways to get the Social Security card, but you can find all the information on that website. And then the photo ID, again, you have to have certain things to even walk into a DMV, RMV to request a new ID, a photo ID. So you need a document providing your date of birth, something with your signature, and then something with the residency. And what I would say for residency, so back to your consumer who's in a hospital or nursing home, they might not have anything. I want to say that a DMV, RMV will not take a Mass Health piece of mail as a Massachusetts residency. I think it's usually like a utility bill or something more on those lines, like a piece of mail. So what you would do for that is you would go to the business office of the nursing facility where your consumer is, request that they on letterhead state, the name of the facility, the consumer's name, date of birth, is a resident of this facility since, and put the date that they were admitted. That a registry or DMV will accept as proof of mass residency, because that is one of the requirements to get a photo ID. So other than that, it's pretty standard. But I don't know where it stands since COVID, as far as I would assume some of these places are open, but that's information I don't know. I would recommend if you have a consumer that does need a renewal or a photo ID, and it is required. They're at that point where they have to go in person. You might want to call ahead or do some digging on your local RMV, DMV to see where they stand, if their hours have changed, if they need an appointment before going, because I honestly don't know how COVID has changed all of that. Okay, and then again, the Social Security income statement, this is back to the income. The consumer might have be employed, so in that case, it would be pay stubs. But if it is Social Security income, it's really, the same as with the card. Like if they can create mysocialsecurity.gov, that's going to be the best way to, then you could go in anytime, as often as you needed, and download and print the newest, most recent copy of your statement. Again, that's not going to work for everybody. So if you go to the website, you can find more information. Sometimes a business office of a nursing facility will help with this too. Sometimes they will assist because this is how they get paid. So sometimes they maintain the latest, most current Social Security income. But if you need a copy newer than what they have on file, sometimes the office, the business office of the facility is the best person to fall back on and say, this is what I need. And just explain to them that I'm working on getting housing for Mr. Jones and he's close to the top of a list, or he's been offered, and this is, they need the most up-to-date income statement. Usually when they know that, you're working diligently with somebody for housing, they're usually more helpful. Okay, next slide. And then the bank assets. Again, in the beginning stages, it's always easiest to just make sure if your consumer has checking or savings account and they're not getting paper. I know sometimes now the banks most of the mailings want to send electronic. But if people, if they have them getting mail, just make sure they're holding on to those. You can always go to your bank and request them too, but I think most banks will charge. So Mass Health will actually pay for bank statements if let's say a consumer for some reason doesn't get their bank statements mailed, and now they're at a point they have to provide bank statements, and their bank's going to charge them $25 and they don't have $25. There is a form that Mass Health will pay for that, but the problem with that is it's a process like anything else. You're not going to fill up that form, submit it, and then have that check in your hands. It's going to take time, and by then the consumer might have lost out on that opportunity. So you just want to make sure, I would say with income and assets, that your consumer is set up to be able to access those when the time comes. The other documents, the ID, the Social Security card, and the birth certificate, have those on hand, because those are never going to renew or refresh. Well, an ID would after so many years, but have those on hand, and then educate your consumer on how to get quick access to bank statements and or updated income information. And these slides have more links that, if you want to click around and find more information. But back to this, just be persistent. Again, your consumer is just going to want to talk about, this is where I want to live, this is what I want to do. Bring them back to the documentation, because some programs you're going to have the documents just to apply. Most you're not. And I think that's what people fall back on, that they didn't need to show this stuff when they applied. But guess what? When the housing opportunity presents, that's when you're going to have to show it. So the point of this is have it ready for when you're asked, because no one's going to wait. They're not required to wait. They really can't wait. It's not really fair to those hundreds of people next on the waiting list that might have all that on their desk ready to go. Your consumers need to be prepared as well. And now we'll spend like 10 minutes on the CHAMP, the online. So the CHAMP is the Common Housing Application of Massachusetts Programs. So DHCD, Department of Housing Community Development, they're the folks who manage the website where you can now electronically apply for Massachusetts state-aided public housing and the alternative housing voucher program. The CHAMP online application. So through the online system, the website lets you submit your application. to one or more housing authorities instead of having to mail or hand deliver an application to each separate housing authority that you want to apply to. You can also keep your application information up to date on the website as it changes, that your address, your phone number, maybe a change of choice. Maybe at the time you applied, you didn't select, Roxbury, and you now want to live in Roxbury. You can go back in and select that one too. If you have an active application at one or more housing authorities, you'll now find it on the website. So they say, this has been in play now for, 2 years maybe. Do not file a new application, because I don't know where most of you folks stand, but the CHAMP it's newer. It's not brand new. It's been in existence now for a little bit, but there was a time when you had to use what was called the universal standard and paper apply to every individual housing authority. Now there's an online system that lets you just check off every city, every town you want to be considered for, which is great. But what had to happen to make that work was housing authorities had to upload every paper application that they had sitting to honor the place that individuals were already on waiting lists for. So if you're a first-time user for the CHAMP, one of your consumers, and that person's telling you, no, I'm already on some waiting lists, you don't want to file as a brand new application, because what happens is that person loses their place on the wait list. So if they really did, if they really are still on a wait list, they didn't get dropped off not being updated on their address, they are still on a wait list, you don't want to create this as a new one. So if you go in and you can't find that person, I would say contact DHCD and say, or the housing authority, and say, wait a minute, this is, I don't want to lose my place on the waiting list. So get to the bottom of it before you don't just go creating a new one thinking that's easier, because what's going to happen is that person will lose their place. So there is that's the link to go to the website to apply for CHAMP. And just be prepared. I had one little note. If your consumer is one of those that isn't a tech savvy person, and let's just say they don't even have an email, just be prepared to help them create an email, because you do need an email as part of your login to create a new account. So some common questions that we get with CHAMP. So again, this was your consumers telling you, well, I'm already on a wait list. I applied for that before. Now you're wondering, well, who entered that application? Is it in there? So it was the responsibility of the housing authorities to upload those into CHAMP. So I guess you can search in there. There's a way to search for an existing account, but I would say if you did that and you cannot find the person, or the consumer just can't, find it, you're going to want to reach out to DHCD. You're not going to just say, let's just start over from scratch. Because if that person really is on a waiting list somewhere and there was an error and they didn't get uploaded, they're going to lose their place the minute you create that new one. I submitted an app a long time ago. Will it still have the same timestamp? So so if, again, a consumer applied in 2003, their application should be timestamped as 2003 accordingly. It didn't go in when the system was created. It went in with the original date of the application. And you don't have to do this all in one shot. It is kind of a complex application. It's simple information, but let's say you start it with your consumer and they don't have some of the information that's required. You can save and go back. You don't have to. It's not one of those applications where you just lost an hour of your time and now you have to go back in and do it again after they get you the information. It is a save as you go, and you can log in, which is great for consumers that might not realize they needed this or they needed that, or they can't sit for that period of time to do all that information. And again, this is one of the hidden ones with the paper application. So I did provide a link. It took me a while to find it, because again, the housing authorities do prefer you to use CHAMP. Like most businesses, I'm sure you all get bombarded with electronic billing, give you a bonus for signing up for electronic statements rather than having your electric bill mailed to you every month. Everybody's trying to go electronic, as is the CHAMP. but you can still apply by paper. And that's the link where you will find the actual printable version of the CHAMP application. And they do have to accept it. You might run into some housing authorities that say, we don't take that, you have to go online. They do have to accept it. So if that ever comes up, you should really let Rachel know or let me know, or let us both know, so that that can be addressed. Yep, so this just asks about certain programs. So right now, as of today, there are only 2 programs you can use CHAMP to apply for. So eventually, DHCD is already working behind the scenes to add all those other programs we talked about. You know, those eventually we are going to find on CHAMP as well. Not the CBH, not the LHAN, but like all those mobile voucher programs, state aided programs. You're going to eventually use CHAMP for a lot more. Right now, it's still considered fairly new, and you can only apply for the 2 programs there. But again, they are working on, you know, uploading the other programs. So eventually you're gonna be able to apply for more. And that just goes back to, there is no one all end all. Oh, I applied, I submitted an application, so now I wait. If you do a CHAMP with your consumer, which you should, as a basic general rule of thumb to apply for housing, you should do a CHAMP for every consumer you work with that needs housing. But just know that that's not all that's available. If that consumer is in an institution, do an LHAN application as well. You know, look at these slides, print them out. Unless you have the ability that I'll never have to keep all this in your brain, all the criteria and all the, you know, eligibility components, print out the power slide, or just have it saved on your desktop, refer back to it. Oh, my consumer is 62, they don't qualify for that. Fine, eliminate that one, go back to the other ones. You want to apply for as many things as you can. And it would be great if I could sit here and tell you, all you have to do is get on CHAMP, and everything we talked about today, you just select, I want this, I want that, I want this, but it just doesn't work that way, because again, CHAMP is managing what's the programs that are from the public housing authorities. Then you have all these private developers like the CBH program opportunities, the LHAN. There's so many different programs. It's probably never going to be a one spot shop where you take the time, do an application, and you have everything. But if you do a nice combination of most of these things, or the ones that, you know, are applicable to your consumer is going to be in a better situation to eventually be offered an opportunity of housing. Whereas if they only do one, or they stay stuck on that fear of a wait list. I'm not going to do this if I'm only going to sit on a wait list. You know, if you're stuck like that, you're not going to have any housing offered to you either. So you have to really kind of encourage and try to work around all that stuff. Yeah, and then you're going to have to just be prepared if your consumer doesn't even use email. You know, before you even try to log on to CHAMP, just maybe create them a free Google one, show them how to do that, and kind of write that down, their name and their password, so that they have that handy, because part of the online login is to use an email. So next slide. Yeah, so the CHAMP is convenient. It's an excellent way to apply. But again, this just reiterates, it's not in Massachusetts, again, we're very fortunate that there's such a mixed portfolio. There's state and federal dollars that go into, you know, big public housing programs, privately funded housing programs. So we have, you guys as options councils have access to all these different programs, but trying to differentiate or keep them all separated and manage it all is not easy. So again, even this training today, it's the tip of the iceberg. You know, you have mobile voucher, you have project-based, and then you have CHAMP. There's still a lot of other programs we haven't dived into today, and we won't. But just know that, you know, a mixed portfolio with your consumers is really what you want to have. Anybody that truly needs housing, try to work on your consumers with, you know, that they want to, if somebody is staying stuck, like, I'm only living in Boston, this is where I was born, this is the only place I ever lived, my doctors are here, That's great, and those are all rational reasons for wanting to stay in that area. However, Boston probably has the highest numbers on their waiting list. Everybody wants to live in Boston. So if your consumer's only willing to apply for one program in Boston, good luck. They're going to wait. Maybe they'll get lucky, but maybe they won't. If you can at least encourage them to look at everything around Boston, and get on those lists as well, or a mobile voucher. So then they can at least, choose to live in Boston with that mobile voucher. You just want to, again, mixed bag. You want to have a good portfolio of different opportunities. And I think the next slide, the last slide, just talks about each city or town. So on top of all of that, cities and towns might even have their own little private pockets of money or funding sources, whether they're state funded or private, whatever. There's no way for any of us to even begin to know all of those opportunities. So let's just say Boston, for example, you have that person, I'm only living in Boston, that's it, not going anywhere else. You've already done the CHAMP, you've already done whatever other ones that are applicable that would land them in Boston, but the list is still small. Go on the Boston Housing Authority website and just explore, because Boston, for example, does have different little programs that were not mentioned here. They're very specific to Boston. So it wouldn't make sense for me to talk about it on a statewide call, because it might not apply to your consumers, only those that want to live in Boston. But if you have that person that's only, stuck on living there, explore, or have your consumer explore. Give them a link. Set them up in your office if you can with a laptop or a desktop and say, here, let's get on here. Let's see what might be available. Because there might be some small little program that, some small pocket of funding with specific criteria that just happens to have everything that they meet. And then they can apply for that. So I don't mean to overwhelm you. Sometimes these trainings, I overwhelm myself, but I just want to stress that, you have your go-to programs, but just know that it's not an end-all, do-all. Like, there's still so much else out there. So a person's never fully done with their housing search unless they just continue to explore, these other side pockets. And maybe where they want to go, there's not a lot in that city or town. And I'm not saying all of them are gonna, but a lot of them do. A lot, like the city of Boston, for example, take time, go on their website and go look. They do have very specific programs. And some of them lead you back to the CHAMP, that here's a little side program if you meet this criteria, but here's how you apply. And they redirect you back to the CHAMP, because again, they're all trying to go electronic. So don't feel like doing any one of these is a waste of time because it's only for that program and not all these other ones. You want to really do a mixture of each one. And I think that was all my slides, Rachel. I think the next one, we just a couple of minutes for questions, and then my contact information is at the end in case you need to contact me.
You took some of the questions from the chat, right? But no, I think we missed a few of them. Did you? I had to step away for a minute, but I think that you were responding to some more recent ones, but there was one about how does your credit rating affect your eligibility for housing, subsidized housing?
Yep, and that's going to, again, vary on where you apply. A lot of this is at the discretion of either a housing authority or a private property. And that holds true with credit and or, let's say, CORI, negative background information. A lot of times that comes up with our consumers. My answer to that is always just be honest. Like on an application, there's almost every application will include questions, not so much credit questions, but background questions, and just always answer honestly, because that's not going to eliminate your chance. No one's going to run a background check for you to apply and sit on a wait list. They're going to run a background check when your name comes to the top and now you're sitting in their office and you have an interview. They're going to have you sign a release that they can run a federal background check or a state background check on you to see your history. That's when those things are going to come up. Or a credit check, that's when those things are going to come up. And I can't answer that because every property maintains the right to handle however they feel, fit. They have their own criteria, and housing authorities do the same. But you always have a chance to appeal. So even if they deny you, no, I'm sorry, Rachel, you failed the credit check, we can't rent to you, you still have a right to appeal, because maybe there's a reason for that, and that's where, again, you would come in as OC, INR, whatever your respective title, and advocate. Yes, there's a negative background blurb right here. This is the reason, and this is how this person's situation is different today than it was 3 years ago. And they're confident that with this housing opportunity that they can maintain stabilization and independence, and that's not going to happen again. And a lot of housing authorities and or property managers are going to take that into consideration and say, okay, fine, they'll put your application through. Some are not. So it's really, you're always going to have the right to appeal, but don't not have a person apply because they have negative credit or a negative background, but just know that, you have to be honest about that because it is going to come up. So if you lie on an application, no, I have a clean background and my credit's great, and then it comes back that both are negative. Now, not only do you have those blurbs on you, you also weren't truthful about it. So, just be truthful. And this is where, you kind of turn your advocacy hats on and get as creative as you possibly can to help your consumers work through these issues. And if you know your person, your consumer has CORI or credit issues right off the bat, apply anyway and start working on those issues while they sit on those wait lists. Find those resources and guide them to those resources and have them start working on some of that stuff, working on getting the documentation while they wait. So the wait lists aren't so bad when you have work to do in the meantime to be prepared. So I would just say, start early and find some resources for that, credit repair or CORI repair or advocacy letters.
Okay, we just have 2 minutes left, but there was one kind of case example that somebody shared that you addressed pieces of this, but I'm not sure if you saw the whole scenario. Of someone who's been off the grid for 35 years, no ID, no health insurance, cannot prove residency, cannot find his birth certificate. How could we assist somebody in that situation?
Yeah, so in those situations, you have to just start from scratch. And the easiest piece, the easiest piece to get is your birth certificate. So that's where you start. That's where we started with the woman with dementia in the nursing home that didn't know where she was born. That's where we started because that was the only piece we could feasibly get without, any more red tape. So I would say start with that. And again, I don't know the specifics on that, but if that person's in a nursing home, hospital, you definitely want to incorporate the staff there, the business office, because they have an interest in that as well. The social worker, anybody you can partner with, you want to share the burden, so to speak, because you can't do it all. Your job is to provide the resource, the education. This is what I know you need. This is how you typically get it. Well, I don't know where I was born. Okay, well, now let's bring in a team and try to figure out that piece. Because, it takes an army sometimes, and, incorporate whatever army that is, whatever's available to you. Just utilize those folks.
Okay. All right. Thanks, Jennifer. If there's any more questions that come in or that didn't get answered, I can get those to you. Okay.
Well, thank you for having me. Hopefully it wasn't too much information. Housing is just not in a nutshell. I wish it was, but it's not. So enjoy the rest of your training, guys, and hope everyone gets a little fresh air today. It's supposed to be fairly nice.
Yep. Thanks. Thanks a lot, Jennifer.
Bye.
Okay. All right. So we are going to take a 15-minute break now, and we'll see you back here at 10:45.